Lichen planus. See, in this condition, the patient will have oral lesions, lesions inside the mouth, as well as lesions in the skin. So, the lesions in the mouth, typically it looks like the lacy appearance of the cloth. So, in the very start, let me show you a photograph so that you understand the condition better. So, this is how it looks like. See this one, this is how it looks like. So, this lichen planus, it's an autoimmune condition. So, autoimmune condition means, see, every one of us, we have a body protective mechanism which you call it as immune system. So, if there is any external triggering factors, external factors like bacteria, virus, fungus, it tries to attack our body, this immune system gets activated, it tries to stop its entry, and if at all it has entered, it tries to stop the further progress and it destroys it all. Sometimes what happens is, without any triggering factor, or maybe the patient doesn't experience that triggering factor, maybe it's a subclinical infection. He doesn't get fever, no sore throat, no eye changes, no body pain. It's subclinical. He may not be aware of it. This can trigger the immune system. Some external factor, like any bacterial infection, any medicines, any external factors like that. So once this immune system is triggered, it targets in any one particular body part and it may get destroyed. So in lichen planus, the part which is targeted and destroyed is the soft mucosal covering of the buccal mucosa covering of the oral cavity. And along with that, even the skin also can be involved. That's what I mean by autoimmune condition. This is very common in the middle age group, say above the age of 20 and 40, more common in females and more common in people who are stressed up. That's why I told you this can be stress related immune system activation also. Now, what are the complaints of the patient? Some of the patients, they may be totally asymptomatic. Maybe they have visited me for some other complaint, and when I examine them, when I ask them a few questions, they tell me yes. If I ask them, do you have a burning sensation sometimes while you take your food? They say, yeah, I used to. And do you have a change of taste? They say, yeah, sometimes I used to. So these patients, they may be asymptomatic, but they may be suffering from the disease, but it is mild form. Some of them, or I can say the majority of them, they come to us or come to me with a specific complaint saying that they are not able to eat normally. It doesn't burn too much, doesn't pain too much, but there is sure discomfort while eating. And when they examine the oral cavity, they find these lesions also. So this will be the complaint. Now, along with this oral cavity lesions, the patients will have skin lesions also, especially so the flexor aspects here near the breast, these parts. This skin lesions, it has got a particular characters. First, it is planar, which means if you examine the skin lesion with a magnifying lens, we'll see the top part of that skin lesion will be flat. So it's called as planar. The lesion which is seen in that particular part will have more than 2 or 3 lesions. That means it is polygonal. Then suppose the lesion which comes together in 2 or 3 or 4 or 5 numbers. In that, some lesions will be small, some lesions can be bigger in size. When it is less than 5 millimeter, it is called as papillar. When it is more than 5 millimeters, little thick, it is called plaque. And when you notice the color of the lesion, it will be purple and the patient will complain of itching, pruritic. So if you notice every word, the first letter P. So you have 6 P's. So when we have this, along with that you have an oral lesion, and sometimes the oral cavity you got striations, which called Wickham stray. When we have all this, we come to a clinical diagnosis that this is a case of lichen planus. Now, There are so many different types of lichen planus, at least 9 or 10. I have mentioned only first 3 common ones. I am not going to detail about that. This is a patient teaching program, so I'll concentrate on how to make the patient comfortable. The treatment part will be taken care by a doctor. Now, this condition we need biopsy. This is to give information to you patients that why we need a biopsy. This biopsy, it is taken from that lesion, part of the lesion. It can be with a knife after anesthetizing that area, or as the technology now, we make use of punch biopsy also. But don't worry, you don't need to be taken to the operation theater. It's a minor procedure. It can be done on the OPD basis also. It is not much pain. So the report will come as lichen planus. Now, why should we do a procedure? Why should we take a biopsy? Because the importance lies in this, that this lichen, suppose it is diagnosed as lichen planus, there is a possibility that this can turn into malignant. If you ask me the percentage, from 0.3 to 3%. So you can put it the other way around also. That is 99.7% it is normal, nothing to worry. There is a percentage that it can become malignant. So it needs attention, it needs treatment for sure. Now we are already diagnosed as lichen planus. Patient now has got 2 problems. One, we have diagnosed the lichen planus disease. The disease has to be controlled. Second, he has got he has got burning sensation, metallic taste. He is not able to eat properly. So these 2 things we have to take care. Now the first one, that is controlling the disease. I have mentioned it is an autoimmune disease. There will be some time when it increases and automatically it decreases, then again waxing and waning. Now, since being autoimmune disease, we have to control. It is mainly brought under control with steroids. Before I start the treatment now, what I tell my patients is, and most of my patients when they come to me, they have a doubt that their peripheral doctor has already told them that maybe this is lichen planus. I'll give you a referral, please go meet this particular doctor. And they Google and find out, and they have set in their mind that this is a malignant condition. Please, please, please. This is not a malignant condition, and the possibility of it being malignant is only 0.3% to 3%. Percentage is very less. So when I give them a reassurance, don't worry, this is not malignant, that time itself, this is what they have been waiting for. This reassurance is very, 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 very important. Next, coming to the disease management. If suppose we have only oral lesions, we'll manage with steroid application, which has to be done twice daily, depending upon your history, duration, and the lesion severity. The doctor, your treating doctor, maybe ENT doctor, maybe an oral pathologist, maybe a dentist, they'll tell you how long you have to take it. Now, along with that, if you take a vitamin A capsule containing a vitamin A or vitamin A containing multivitamin, it will be better. Those patients who have got oral lesions, mouth ulcer or mouth lesions, and they have skin lesions also, then they need oral steroids. You have to take tablet form. Steroids are strong medicines. It has got so many side effects. Suppose you are diabetic or hypertensive, the side effect increases. So the doctor will decide how much dose to be given, how long it has to be given, and you have to stop and maybe in a low dose continue, then again you have to restart the dose, depends upon your waxing and waning. But keep in mind that this has to be taken strictly after food, and if you suppose you are diabetic and hypertensive, you have to meet your physician and check your blood pressure and sugar and bring it under control till the dosage of steroid is slowly tapered and stopped. Along with this has to be taken after food. Along with this, you have to take a proton pump inhibitor so that your acid production is under control, because this can increase acidity. This is about management. Some patients, they are resistant to steroids. It cannot be brought under control with steroids. So we need to start immunosuppressants like cyclosporin or methotrexate. This is about treatment. Now we have to make the patient comfortable. He has got metallic taste, he is not able to breathe properly, eat properly, burning sensation, some irritation. He's not. So all this we have to bring under control. The main thing is your food lifestyle modification is very important. Avoid spicy foods, chicken, mutton, fish, hard foods you have to totally avoid. Junk foods, all drinks, beverages you have to stop. Quit smoking, stop taking alcohol, take more of vegetables, juice except citrus, mainly lemon and pineapple to be avoided. Hot drinks, hot coffee to be avoided, chocolates to be avoided, and over brushing that particular part is bad. All these things to be avoided. Now, I'll tell you some home remedies which will make you a little more comfortable. These are, I'll just name a few. You can select any one of them, decide which suits you, and you can follow that particular one when you have more problem. To start with honey. You can apply organic honey, apply over that area and leave it like that for next 1 or 2 hours. Please do not drink or eat anything. I said twice daily, so you can apply in the night also. Go to bed to sleep. Now, first one I have told you about honey. You can do gargle with salt water gargle or turmeric gargle or garlic or with aloe vera or with tulsi or with cabbage. All this you can make a paste, apply for some time, or you can use as gargle also. Taking 1 spoon of yogurt every day after lunch is a good idea. Plain salt water gargle, 1 glass of water, 1 teaspoon of salt, plain salt, not iodized. If you add up Himalayan salt or rock salt, Himalayan salt, rock salt, or even this one more is there, no? Okay, doesn't click fast. Himalayan salt and rock salt. Wow, that's it. Pink salt. Any of these 3 is okay. So when I said non-iodized salt, why I said non-iodized, because sometimes it can irritate the lesion. But if suppose you have only non-iodized salt, even that is okay. So if suppose you use salt water gargle, you have to do at least 2 or 3 times daily. So these are the home remedies. And the last one, few more. This pure coconut oil you can apply in the oral cavity, not one you get in the market. Pure coconut oil. That also can apply twice daily. Or coconut milk, that you can gargle coconut milk once daily, every day when you have exacerbation. And the last one is tulsi leaves. If you can take 1 or 2 leaves per in a week's time, if you take 3 times in a week, that will be good idea. So these are the home remedies where if you do this, it will make you a little more comfortable. Now, what all things to be avoided, I have already mentioned. So, Lichen planus, it's an autoimmune condition. How it presents and what is the cause for it, I have already mentioned. Biopsy is a must. Treatment is a must. There is a possibility of malignancy, but don't worry, it can be easily brought under control. We can make your life comfortable, but treatment is a must, and follow up with your doctor regularly is a must. Thank you so much.